I want you to imagine a man named Robert. Robert is 65 years old. He has just retired. He wakes up every morning at 6. He drinks his coffee. He plays 18 holes of golf. He has no pain. He has no cough. He has no symptoms. He is, by all accounts, a picture of successful aging. But for his 65th birthday, his children buy him a gift. They buy him a gold standard full-body scan. They tell him, "Dad, we just want to be safe. We want to catch anything early." It sounds like love. It sounds like responsibility. But in reality, it is a trap. Robert goes to the clinic. He lies in the machine. The machine scans him from head to toe. It slices his body into thousands of digital images. And because Robert has lived on this earth for over 6 decades, the machine finds something. It finds a tiny shadow on his left lung, 3 millimeters. The radiologist writes a report. Indeterminate nodule, cannot rule out malignancy. Suddenly, Robert is not a healthy golfer anymore. He is a patient. He stops sleeping. He stops enjoying his retirement. He stares at the ceiling at night, thinking about cancer. His doctor is worried too. The protocol says they must investigate. So they order a biopsy. They stick a long needle through Robert's chest wall to grab a piece of the shadow. But Robert's lungs are 65 years old. They are more fragile than they look. The needle punctures the air sac. His lung collapses. Robert is rushed to emergency surgery. He needs a chest tube. He gets an infection in the hospital. He spends 3 weeks in bed. He loses 15 pounds of muscle. He becomes weak. He needs oxygen just to walk to the bathroom. And the pathology report? It comes back 5 days later. Benign scar tissue. It was a harmless scratch from a cold he had 30 years ago. It was never going to hurt him. It was never going to grow. But the test hurt him. The test took away his golf game. The test took away his new freedom. This is what I call the medical cascade. And if you are over 65, it is the single greatest threat to your independence. Modern medicine is a miracle. I am a doctor and I believe in it. But modern medicine was designed for a specific purpose, to find disease in young, resilient bodies. When you apply that same aggressive search and destroy machine to an aging body, you do not find health, you find incidental omas. This is a medical term you need to memorize. Incidental means accidental. Oma means growth. An accidental growth. A cyst on the kidney, a nodule on the thyroid, a white spot on the brain MRI. If you scan 100 healthy 65-year-olds, 90 of them will have an incidental oma. These are not diseases. They are the internal equivalent of gray hair and wrinkles. They are the scars of time. But the medical system does not know how to ignore them. It is legally obligated to chase them. One test leads to another test. A shadow leads to a biopsy. A biopsy leads to a surgery. A surgery leads to a complication. And a complication leads to a funeral. You might think I am being dramatic, but I have seen this happen thousands of times. We take a healthy, happy senior and we turn them into a full-time patient. We fill their calendar with appointments. We fill their mind with fear. And we physically damage them in the pursuit of perfect health. So today we are going to draw a line in the sand. I am going to show you the 4 specific tests that trigger this cascade. These are tests that are routinely ordered, routinely pushed, and routinely ruin lives. These are the tests I would never let my own father get. And the first one is the one that looks deep inside your brain, searching for a ghost that isn't there. Let's look at the brain scan trap and why forgetting your keys does not mean you need an MRI. Why forgetting your keys does not mean you need an MRI. The brain trap. Let's talk about the fear that keeps every person over 65 awake at night. Dementia. You lose your keys. You forget a name. You walk into the kitchen and forget why. And immediately, the panic sets in. You think, this is it. It's starting. So you go to your doctor. You demand a brain MRI. You want reassurance. You want to see that your brain is clean. But here is the problem. At 65, no brain is clean. If you put a perfectly healthy 65-year-old into an MRI machine, the image will not look like a textbook. It will look like a battlefield. The radiologist will write a report, and they will use words that sound like a death sentence. Cerebral atrophy, small vessel ischemic disease, white matter hyperintensities. You read that report, you see the word ischemic, you see the word atrophy. You think, my brain is shrinking, my brain is dying. But what the doctor should tell you, but often doesn't, is that these are internal wrinkles. Just as your skin gets spots and lines as you age, your brain tissue changes. Atrophy just means your brain volume is slightly smaller than it was at 20. Normal. White matter spots are tiny scars from living a long life. Normal. 95% of seniors have them. But now you have a diagnosis. You start testing your memory every 5 minutes. You become anxious, you become depressed. And ironically, anxiety and depression actually ruin your memory. The test didn't find a disease, the test created the disease. Unless you have sudden confusion, a stroke, or a seizure, a brain MRI for routine forgetfulness is an anxiety machine, not a medical tool. The full body scan scam. And it's not just the brain, it's the full body CT scan. These are sold in shopping malls now. Peace of mind, they promise. They are lying to you. They are selling you panic. Because if you scan the kidneys of a 70-year-old, you will find a cyst. If you scan the thyroid, you will find a nodule. If you scan the spine, you will find degeneration. These are incidentalomas. Remember that word. Most of these abnormalities will never ever grow. They will never hurt you. But once you see them, you cannot unsee them. You will undergo follow-up scans every 6 months. You will get radiation you don't need. You will get biopsies that carry risks of infection. You are chasing ghosts. And while you are chasing ghosts, you are missing the real risks. Because while you are worried about a tiny spot on your kidney, your doctor might be putting you on a treadmill. And that treadmill test for a healthy senior is statistically one of the most inaccurate tests in medicine. It is a coin flip. And if it comes up heads, you might end up with a catheter in your heart that you never needed. Let's look at the cardiac trap and why running on a treadmill might break your heart.
Why running on a treadmill might break your heart. The cardiac trap. You are 72. You feel fine. You walk 3 miles a day. But your doctor says, let's just check the ticker. So they put you on a treadmill. They hook you up to electrodes. They make you run. This is called a cardiac stress test. And for a healthy, active senior, it is often a coin toss. Here is the dirty secret of cardiology. Stress tests have a notoriously high false positive rate in older adults. Maybe your heart rate didn't go up fast enough because of a medication. Maybe the EKG line wobbled because of your chest shape. The machine flags it abnormal. Now the trap snaps shut. The doctor cannot ignore an abnormal result. They are scared of a lawsuit. So they say, we need to take a look inside. They order an angiogram. This is not a scan. This is surgery. They thread a catheter through your wrist or groin all the way up into your heart and inject dye. It is invasive. It carries a risk of bleeding. It carries a risk of stroke. And what do they find? Usually nothing. Or they find stable plaque, hardened arteries that you have lived with for 20 years and were never going to kill you. But now you have been poked, prodded, and terrified. You have risked a stroke to confirm you are healthy. If you can walk up 2 flights of stairs without chest pain, you have just passed the best stress test in the world. Do not let a machine tell you otherwise. The colonoscopy wall. And then there's the procedure everyone dreads, the colonoscopy. We are told it is the gold standard for cancer prevention, and for a 50-year-old, it is. It saves lives. But there's a biological wall that happens around age 75. At 75, the benefits of a colonoscopy start to drop and the risks skyrocket. Why? Because the wall of your colon gets thinner as you age. It becomes like tissue paper. When the doctor pushes the scope through, the risk of perforation, poking a hole in the bowel, doubles or triples. A perforated bowel is a surgical emergency. It means sepsis. It means emergency surgery. It often means waking up with a colostomy bag for the rest of your life. Now let's look at the math. A colon polyp grows very, very slowly. It takes 10 to 15 years to turn into cancer. If you are 80 years old and you have a tiny polyp, statistically something else will claim you long before that polyp does. But the test to find that polyp, the perforation, the anesthesia, the dehydration from the prep liquid, that can kill you this week. The risk of the cure is higher than the risk of the disease. This is why major medical guidelines now say stop screening after 75. But many doctors, out of habit, keep ordering them. They're treating the calendar, not the patient. They're checking boxes while you are taking all the risk. So, we have seen the lung trap, biopsies, the brain trap, MRI anxiety, the cardiac trap, false positives, and the colon trap, perforation. Does this mean you should never go to the doctor? Does this mean you should ignore your health? Absolutely not. It means you need a new strategy. You need to stop playing defense against imaginary diseases and start playing offense for your function. Let's look at the protocol of survival and the 3 questions you must ask before saying yes to any test.
And the 3 questions you must ask before saying yes to any test. The functional shift. So what should you do? If you can't trust the scans, how do you know you are healthy? You change the metric. You stop measuring incidentalomas, and you start measuring function. A healthy 70-year-old is not someone with a clean MRI. A healthy 70-year-old is someone who can walk a mile, someone who can carry their own groceries, someone who can get up from a chair without using their hands. These functional tests tell us infinitely more about your longevity than a blurry picture of your kidney. If you feel strong, if you have energy, if you have no pain, then biologically you are winning. Do not let a radiologist convince you otherwise. The 3 survival questions. From this day forward, whenever a doctor suggests a new test, I want you to pause. I want you to ask 3 specific questions. Write these down, put them in your wallet. Question 1.
If we find something, will it change my treatment? This is the most important question in medicine. If you are 85 and you would never agree to aggressive chemotherapy or major surgery because of the risk, then why are we doing the biopsy? If the answer is no, we wouldn't operate anyway, then the test is useless. It is just curiosity, and curiosity kills the patient. Question 2. What is the risk of the test itself? Don't ask about the benefit, ask about the cost. What is the risk of a false positive? What is the risk of infection? What is the risk of a perforated bowel? Make the doctor say the number out loud. Often, when they say it, they realize it sounds crazy. Question 3. Is there a non-invasive alternative? Instead of a stress test, treadmill, ask for a coronary calcium score. It's a simple CT scan. No running, no needles, no risk. It tells us if your arteries are hard or soft. It gives us the answer without the trauma. The conclusion. I know it is scary to say no to a doctor. We are trained to follow orders. We are trained to be good patients. But being a good patient in the modern medical system often means being an over-treated patient. It means trading your quality of life for a stack of paper reports. You have earned your gray hair. You have earned your wrinkles. And yes, you have earned your cysts and nodules. They are part of you. They are the evidence that you have survived. Do not let anyone turn your survival into a disease. Stay active, eat well, listen to your symptoms. But for the love of God, stop looking for problems that aren't looking for you.